Hello, I'm Kumar Kunasingam, consultant orthopaedic surgeon at Shirley Oaks Hospital. I specialise in bunion treatment and bunion management. If you're struggling with bunions and need help managing your bunion pain, you're in the right place. I'm here to help provide as much expert advice and information as possible, having treated hundreds of people with bunions throughout the course of my career. So let's talk bunion pain. What are the signs and symptoms of bunions? A bunion usually has a range of uncomfortable symptoms, the most common being pain or soreness around the big toe joint, especially when walking or wearing tight shoes. There is often swelling and redness at the base of the big toe. This can be accompanied by the visible big bump, which is the bunion itself. And the big toe then shifts across to the lesser toes. The pressure on the toes together can cause corns and calluses to develop. This then causes further rubbing and pain. Pain from the bunion can be persistent or come and go, but often it gets worse over time if left untreated. Let's talk pain management. What are your options? First things first, footwear. Choosing the right footwear is essential in reducing discomfort and preventing further irritation of the big toe. Look for shoes with a wider toe box, sometimes a bit deeper too. This will allow your toes to spread out naturally, avoiding pressure on the bunion. Softer materials like soft leather, suede, calf's leather, or mesh stretchy trainers reduce that rubbing and friction on the big toe area and allow your foot to adapt a little bit more inside the shoe. Conversely, higher heels, narrow, pointed and stiffer shoes can squash your toes together and cause a little bit more pain in that bunion area when your toes crowd. You could think about nice arch support in your shoes, but sometimes this redistributes the weight within the foot area, relieving pressure from the joint. In some cases, custom insoles can help. These can be an effective tool for managing bunions by providing additional support and helping align and cushion your feet. These insoles are designed to redistribute pressure away from the bunion, reducing then pain and preventing some stresses through the joint. Bunion pads could potentially be helpful as well, and these are designed to basically act as a buffer or a cushion between your shoe and the bunion itself, and therefore taking down rubbing and alleviating pain. You can also try traditional icing methods. I'm a big fan of ice packs, be it frozen peas or ice from the freezer. This can take down some of the swelling and therefore pain, and it's often really helpful at the end of the day if you've been on your feet for a long period of time and you've had lots of rubbing in shoes. To avoid damaging the skin surrounding your bunion, wrap your ice or frozen peas in a towel before pressing down, holding the towel in place for no longer than 20 minutes at a time. Next, you can try traditional painkillers to ease bunion pain. Painkillers can provide much needed relief, especially during flare-ups or after long periods of standing or walking. Over-the-counter medications such as simple paracetamol or ibuprofen are commonly used because they not only reduce pain, but they can reduce some inflammation around the affected joint. You can get prescription medications for bunions if the pain is particularly bad and there's lots of inflammation. Another potential effective option for bunion pain management is tailored exercise. While weak muscles in your feet and legs don't cause bunions, they can contribute to bunion pain, making it difficult to walk and carry out daily tasks. To counter this, you can perform a series of bunion exercises to strengthen the smaller muscles in your feet and improve the flexibility of your big toe joint. However, these exercises don't get rid of bunions. Surgery is the only way to remove your bunions. If the methods of bunion pain management I've described don't manage your pain enough for you to be comfortable, you then need to probably think about bunion surgery to remove or fix your bunions. The type of bunion surgery your consultant recommends is based on several factors, including the severity of your bunion. So what happens during bunion surgery? Surgery may involve an open approach where your surgeon will make an incision or cut along the length of the first metatarsal, across the joint and into the bone on the other side of the big toe joint, which is known as the proximal phalanx. It's also possible to use an open approach lower down the foot, and this essentially involves realigning the first metatarsal and fusing it to a nearby area of the foot. Finally, there's also worth considering minimally invasive or keyhole surgery, utilizing 5 small cuts which break or osteotomize the bones as well, either side of the big toe joint, moving them into a straighter alignment. All of these approaches will use a combination of plates or screws. The recovery time will depend on the approach you've had and should be discussed in detail with your surgeon. Your surgeon will ensure that you have all the details you need ahead of surgery so that you feel prepared. Everyone recovers at different rates, but typically takes several weeks to a few months. In the initial phase, you may need to keep your weight off your foot or walk carefully with a flat foot. You may be given crutches and a special surgical shoe to protect the bandage. It is really important to elevate your foot as much as possible, depending on your surgical instructions, but this will help keep the swelling down and you will be more comfortable. Generally speaking, people return to normal activities within 6 to 12 weeks. If you're struggling with bunion pain, it's important to know that there are many options for you to try and manage the pain and remain fit, healthy, and active with bunions. Thank you for watching this video. If you have any more questions about managing bunion pain, please leave your comments in the section below. We'll get back to you as soon as possible. If you would like to arrange a consultation with me to discuss your bunion and potential treatment, you can book an appointment with me at circlehealthgroup.co.uk. Thanks again.